Just like some other countries around the world, including the United States, where I'm reporting from, Nigeria has its own fair share of attacks by insurgents. Conflicts and disasters have become commonplace globally, with their attendant health consequences.
ACOG doesn't have any direct...
Finding ways of mitigating the impact of terrorism and other conflicts on human health is top on the agenda at the 2015 conference of the Association of Nigerian Physicians in the Americas.
The effects on individuals, there's physical injury, the psychological injury, and cognitive effects. When you abduct a kid who is 8, he misses school, he misses the influence of parental, philosophical teachings, grandparents, and so on. So there's some deformity in character development. There's some deformity in moral development.
When you have a breakdown of essential services, people go to their barbaric worst, and armed conflict, because of what happens with regards to gender-based violence, increases the rate of sexually transmitted infections, including HIV and AIDS.
Borrowing a leaf from older democracies such as the United States with a better organized health sector could go a long way towards making healthcare delivery in Nigeria during natural or man-made disasters more efficient.
You're required as a hospital to have a disaster plan. So I know there's a few hospital administrators in the room. I'm sure they work with what the disaster plan is. You really should be familiar with what the disaster plan is where you work, because you'll have a role in the disaster.
Humanitarian agencies need to integrate reproductive health into service delivery. So as you're planning to intervene in conflict areas or give refugee and humanitarian aid, these issues of women and child health during these times should be built into that. So it's not an afterthought.
The only way to move forward in Nigeria, either we like it or not, is also health insurance. In health insurance, everybody will contribute. It is not free, I'm going to mention it to people. But the healthy majority will be taking care of the sick minority.
Challenges abound all over the world, but making concerted efforts at providing not just social, economic, but also health security is one of the defining factors of an efficient government. From Orlando, Florida, in the United States, Yomi Otaigbe reporting for Channels Television News.